All right, everybody, we are back on a Monday. The physicians from Trident Pain Center join us right now with information on some state-of-the-art pain management and relief techniques. Dr. J. Edward Nolan and Dr. Allison Thatcher join us right now. Guys, thanks so much for being here. We do appreciate it. Tell me about the Pain Center and how it's kind of expanded for you guys in the past year.
Well, actually, we have expanded. We just opened a new office in the Walterboro area. We've also expanded. We've been out in Monk's Corner, but we've expanded the number of days which we're going to be out there. We've gone from 2 days a week to 3 days a week in order to provide pain management for some of those underserved areas.
Dr. Thatcher, are you seeing more people coming in and suffering from pain, and what specific kind of symptoms and conditions are they going through?
Well, we do pretty much all pain management, a lot of spine, diseases of the spine, as well as knees, shoulders, hips. We treat pretty much all areas of pain.
And that's got to be a good thing, because people used to go to hospitals for this, Dr. Nolan, and now that there are different places that you're not going to have to wait in those very long lines for something that might be a chronic condition for you.
And we're trying to offer as many locations as possible to be as convenient as possible for patients. We've got our Monk's Corner, Walterboro, and the North Charleston area. And then we also just recently acquired an office in Mount Pleasant as well.
Wonderful. So tell me about how the growth and how it's beneficial to both your patients and the community at large.
Well, people suffer from pain, quite a bit of pain, and we're just trying to make it more convenient for them and make it where they don't have to drive as far to get the relief that they need.
Yeah, wonderful. And you guys have some state-of-the-art tools there at the center, and you brought one along today. So can you explain to us what this is for our viewers right now?
Well, this is a very special device. There's a procedure that's been being worked on for 30 years, and a doctor in Arizona developed this particular device to be able to be used to take away migraine headaches.
Okay, so this is used for migraines. How exactly does it work, keeping in mind that this is a family show, of course?
Well, you place the catheter using the x-ray machine through the nose into the nasal cavity, and you inject just a little bit of medicine, and it can be very, very effective at taking away migraines for 3 to 4 months.
Really, 3 to 4 months?
It's amazing.
Wow, that really is amazing. So what kind of other things? Migraines, obviously a big one, spine, a big one. Are people having surgeries, getting into maybe car accidents, things like that, and having lasting effects from that? Are those the people that you want to come and see you?
Well, we're treating those as well. I mean, we do treat post-head injury type headaches, but it's predominantly intended for migraine headaches. But some patients are visiting urgent cares or ERs, getting injections. So this has been revolutionary in treating pain. We've done over 250 procedures at this point, and our success rate has been unbelievable. Is
there a faster recovery time using this method versus a traditional?
Well, there's really not much recovery time. The next day they usually feel good, and this particular device works very, very well. We also do concentrate on the spine, the neck, and the low back, and there are a lot of different ways of helping people feel better without having to go through more intensive treatment like surgery, things like that.
Wonderful. If people need to get in and see you because they're in a lot of pain, they're watching this right now, where exactly do they need to go?
Well, TridentPainCenter.com is our website, but if you pull it up online, it has all of our new locations and our main phone number, and gives a lot of information about the procedures we perform and how to access this.
And Dr. Nolan, if somebody is watching out there right now and they're in pain, when is that threshold? When do they need to come and see you or go and see you know, a doctor of any sort because the pain is just too much? Of course, if you have a toothache, some people say that they can grit it out. When does it become too much?
Well, when it's affecting your life. Pain is about blood flow, and our job is to provide reinstate blood flow to the areas that are in pain. So you don't want to leave it for a prolonged period of time, because those cells are actually put at risk for death. So we want to be able to reinstate or cause the blood flow to come back and get the person back healthy and feeling better and get them back to living their life.
Indeed, and you can do that with Trident Pain Centers. Dr. Thatcher, Dr. Nolan, thank you guys so much for coming here. We do appreciate all the information on your screen right there if you are in need of some pain relief. Stay with us. There's more Low Country Live coming up after the break.